You're watching McLaren Port Huron's Today's Health, and we're talking with Dr. Bashar Samman about congestive heart failure and, hey, how do you stay well, feel as well as possible? So that's my first question. What's the biggest challenge for patients that have received this diagnosis?
Really, the important part is for us to remember that this is a disease. We get better, but it doesn't go away. Mm-hmm. We have a history of heart failure. We are now healthy, able to do everything we want, but we have in the background the disease itself. What do I mean by that? Is taking the medication is not only when I don't feel well, it's taking the medication all the time. Being careful about our eating habits, it's all the time. It's a lifestyle change, and that's unfortunately what we get into trouble with. So the classes of medication that I talked about, the ACE inhibitors, the beta blockers, if you need to be on a cholesterol medication, if you need to be on an aspirin, depending on what else we have disease-wise, it's not only when I don't feel well, it's all the time. Skipping the medication is not good. And then we need to look at our lifestyle, what we do every day. What do I mean by that? Smoking is an absolute no-no. It's not even, a question. Our eating habits. And eating habits, part of it is our salt intake. Why is that important? It is not unusual for me to see people coming to the office feeling short of breath in heart failure, or what we call exacerbation of heart failure, acute heart failure exacerbation. And when you go over things, it's what happened, why? And the reason is because we were on a trip. We were on a cruise for the last 2 weeks. And what happens? We don't eat healthy. We eat salt, we eat more than we do usually, and we don't eat the kind of food we eat usually. Trips are fun, it's nice to travel, but we gotta be careful. And when I talk about salt and heart failure don't like each other. They get, it's a troublemaker. And a lot of us, when we ask somebody about salt, they tell you, no, I don't add salt. But we have to be careful. A lot of the food that is already prepared is full of salt. Mm-hmm. And that's where we get in trouble. Restaurant food, packaged food, canned food, fast food, salt. And most of us may get away with that. But if we have a history of heart failure, a load of salt is the difference between breathing well and not breathing well. And that's all what it takes. So there are certain things we definitely can do, and we need to learn to do every day. And it's a lifestyle change. And that's why I go back to that word. It's not a temporary thing. Because if we do it temporary and we go back to the old-fashioned way, we'll be quite naive to believe that we're not going to get in trouble again, because we will.
So we're really talking about, too, for people that are at risk for congestive heart failure, it's the same thing. Lay off the salt.
Oh, absolutely. Absolutely.
Exercise.
Absolutely. As a society, we eat more salt than we need. There's no question. That's been shown. In matter of fact, it's been shown that if we reduce our salt intake, the mortality of our society will go down just by reducing our salt intake. So that gives you an idea. Now, if we go to the exercise, even if we have heart failure, even if we have advanced stage of heart failure, exercise does help the symptoms. Even if the muscle of the heart is weak, because the body becomes more efficient to function with a weaker muscle of the heart. So some people with heart failure benefit from cardiac rehab to get their ability to function, the ability of the body to function with a muscle of the heart that's weaker than it should in a much better term.
Do people with congestive heart failure feel well enough to be able to get up? And we're not talking running or anything. We're talking
oh, no, they can run.
Really?
They can run. First of all, heart failure is a very wide spectrum.
Okay.
And we can get in a tough situation, but then we can get better with treatment.
Okay.
And with exercise, any kind of exercise is important. From walking, to swimming, to biking, to running if you want to run, whatever you want to do. Heart failure doesn't mean we cannot function. Matter of fact, being active physically helps a lot, not only to control our risk factors, but improve the way we feel. And there's some data that show that it improves our life span.
Well, we'll talk just a minute about how do you know if you're getting in trouble and, like you said, you're getting worse, and what should you do?
You know, one of the things that help us at home is following our weight. You know, if we gain 2-3 pounds overnight, it's not the meal we had yesterday.
Okay.
We're starting to retain fluid in people that have heart failure. So monitoring our weight every day at the same time of the day, same, you know, lack of clothing, same clothing. I'm not looking at the absolute number, is the difference. Did I change? Because some people may go to their doctors and they have a different scale than the scale at home, and that becomes quite confusing at times. The same scale, same time of the day, see what the weight. You've gained 3-4 pounds. Either give your doctor a call or take an extra pill of water pill, and that will get us back in trouble. What happens, some of us, we wait until we're 10-15 pounds up. And by then, we're in the emergency room because it cannot be treated as an outpatient anymore. The whole idea with heart failure is a chronic disease. So the treatment is lifetime. It's not the temporary time. It's not an infection, I took antibiotics, I'm done. So we need to be careful and follow the direction of your doctors. And make sure to stay well, because you can. But we have to do everything we can to keep out of the hospital.
Thank you so much for joining us today.
Thank you.
And thank you for joining us. We've given you a lot to think about and a lot to help you stay healthy. And if you'd like a copy of this program, you know, you can just go to our website and say, hey, I'd like a copy. Or you can always watch this on our website. Maybe every morning for some of us might be a good idea. Or you can call us at Health Access. That's 1-800-228-1484. We hope you join us again next week for Today's Health. Today's Health is brought to you by McLaren Port Huron, doing what's best.